Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortifeye Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor, or Ask the Doctors this morning. That's Dr. Michael Lange and Dr. Susan Summerton here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, or a nutritionally related topic. And I am here live in the studios broadcasting from Salem Media and beautiful downtown Tampa Bay. If you've got a question, remember this show is dedicated to you, the listener, the consumer. So no matter how simple, like I said, or complicated it is, you pick up the phones and give us a call. The phone number, I'm going to give it to you twice, is 1-877-969-8600, 1-877-969-8600. If you're new to the program, who's Dr. Lange? I'm a board-certified optometric physician. I'm a certified nutritional specialist. I have degrees in psychology and physiological optics as well. I started hosting Ask the Doctor in April of 1993. Folks, that's over 31 years, nonstop. Used to have a drive time show here in Tampa Bay, 9 o'clock in the morning, 7 days a week for many, many, many years. And I think that's one of the reasons we grew so fast. We opened 14 large eye care centers in the state of Florida, 3 LASIK centers. We had quite the crew, ophthalmologists and optometric physicians and opticians, all in our network. And I was blessed a few years back to have a company that made me an offer I couldn't refuse. So I sold everything except the Lange Eye Institute. So I hail from the Lange Eye Institute. Dr. Lori Caputi, Dr. Susan Summerton, all work at the Lange Eye Institute in the Villages, Florida. And Dr. Summerton, I said last week, and some people got a kick out of it, she is the asset. You know, that's how the CIA calls their employees, the asset. So she is the asset at the Lange Eye Institute and Fortifeye Vitamins. Dr. Summerton is also a board-certified optometric physician, a certified nutritional specialist, and she's fellowship trained in nutrition and a diplomat in nutrition as well. Good morning, Dr. Summerton. How's everything?
Good morning. Doing well. I'm calling in from the Villages here, and it is a beautiful, nice sunshine day. Looking forward to hearing the callers' questions today and sharing the knowledge that we have been working on and continue to research so we can bring that good information and help our patients and help our listeners.
And, you know, one of the topics we are going to discuss a little bit later in the show is the female athlete. And you are a female athlete and in amazing condition. And I bet you already have worked out this morning, haven't you?
I did. I actually just returned from my 50-minute strength training because depending on what stage of life we're in, different exercises are more crucial. And especially the older we get, and we are sort of falling in that range, that resistance training. And not only just we got to build that muscle, we really need to maintain the muscle. And that helps to lead a long, healthier life. And it's not easy, but it does take a little bit of effort, but we get assistance through the right food we eat and just making it part of our schedule. And then you just feel much better after that. So that keeps motivating you to go forward.
Amen. And while she was talking, I'm holding up, and for all the viewers out there, Fortifeye Fit Pro. It is something Fortifeye we all developed. Fortifeye Fit Pro is a combination of grass-fed whey protein, grass-fed collagen protein, German Creapure creatine, HMB, something called MyHMB, betaine anhydrous, L-citrulline, vitamin D, and peak ATP. No stimulants, no caffeine. And folks, this is for anybody at any age to help build muscle, strength, and endurance. So a lot of our elderly patients are taking this. A lot of people on the GLP-1 receptor drugs to help lose weight so they don't lose muscle are taking this. A lot of our young athletes, our older athletes, I take it. My mom takes it. She's 96 years old. Dr. Summerton takes it. So check it out on the website, Fortifeye Fit Pro at Fortifeye.com. That's Fortifeye, Fortifeye.com. And we're getting ready to take the next call, but I want to mention first, we have not mentioned this in about 4 years, so it's about time. And a lot of you have been biting at the bit for us to have another fall festival at the Lange Institute. Well, we had a fall festival every year since 2006, since we opened the Lange Institute. Every single year, we have music, we have catered, we have food, we have huge discounts on frames and lenses and vitamins, and people come from the tri-state area. We usually have 5,000-6,000 people show up, sometimes more. Well, we're going to do it again in November. Saturday, November 16th is going to be the annual Lange Institute Fall Festival in the Villages. Put that on your calendar. Saturday, November 16th. We're going to have music, food, huge discount. We don't know what the theme's going to be yet, but we're inviting everybody that hears us to come on out, all of our patients, anybody that listens to the radio, come on out and have a lot of fun. We're going to do some live radio broadcasts also. And Dr. Summerton's going to be there. Dr. Caputi's going to be there. It's going to be fun. All right. Let's go to the phones. We're getting loaded up. We're going to go to Nancy in Summerfield, Florida. Nancy, good morning. Welcome to the program.
Morning.
Nancy?
Yes, I'm here.
Listening
Can
to
you
the
hear me?
radio. Nancy.
No, I turned the radio off.
Ah, good. There you are. All right, we got you. What can I do for you?
Yes, I have a question about floaters.
Yes, ma'am.
Eye floaters. Is there any prevention? Is there any way? Surgery.
Well, all right. So floaters oftentimes are a normal process of maturing. Okay, as we get older, the vitreous of the gel on the eye starts to thin out. It's called vitreosyneresis, and we start to see particles that have been trapped in there, believe it or not, since birth. And there's another type of floater called a posterior vitreal detachment, where the vitreous in the gel starts to thin out. It pulls loose, and you get things that float around in your vision. You can get a cobweb in your vision. Most of these are benign. However, you have to get into your local optometrist, optometric physician, or ophthalmologist. Have your eyes dilated, okay? And also, I always recommend an optomap as well, because an optomap kind of makes sure the doctor doesn't miss anything, because we're not perfect. And we want to make sure there's not a small hole, a tear in the retina, a retinal detachment. So floaters can be a telltale sign of that. Oftentimes it's not, however, but if you don't look, you don't know. Isn't that right, Dr. Summerton?
That's right, because they do come in different shapes and sizes and different reasons, but we primarily want to check right away that it's not a piece of the retina floating around or any blood floating around, because those are urgent conditions that need to be taken care of right away. The sooner they're fixed, the better the result. So a lot of times they come in, and most of the time we get to give patients the good news that it's just the normal kind of age-related floaters. But there definitely are times when we have to get them into surgery pretty much the same day to have that fixed. So that's we just want to make sure that we're taking care of the patient and we want to maintain their vision.
Right. And once again, the key is early detection. So a sudden onset of flashing lights, thousands of little floaters, get into your local eye doctor immediately. And yes, there are surgical procedures. So obviously, if it is a retinal detachment or retinal tear, it needs to be surgically fixed, all right, with a laser, a cryotherapy, and sometimes major surgery. But let's say hypothetically, all you have is floaters, okay, and it's not a retinal tear or retinal detachment, but they're driving you bananas, okay? And there's a lot of floaters, and they're really starting to impair your vision. Then a competent retina specialist can do a vitrectomy, where they go in and they remove the floaters. Now, I kind of stand by what my mama taught me. If it ain't broke, don't fix it. All right. So if the floaters are not bothering you, as long as you see your eye doctor, per their instructions, I wouldn't be concerned about it. So hopefully that answers your question. We're getting ready to take another call in just a second. If you've got a question, give us a call at 1-877-969-8600. That's 1-877-969-8600. We are coast to coast on a multitude of radio stations, and we're live video streaming all over the world. So it's good morning, good afternoon, or good evening, just depending on what part of the globe you're watching us. And a lot of you do talk to us on social media. I see a lot of people chiming in from all over the planet on social media right now. Remember, there's a lot of fake Dr. Michael Langes. I'm going to emphasize this again. Instagram and Facebook has gobs and gobs of fake Dr. Michael Langes. If you go to my Instagram, it's Dr. Michael Lange _ The Dr. Michael Lange without an underscore is not me, okay? It's a fake one. So Dr. Michael Lange _ I have a blue check, 50, 60,000 followers. You can become a follower. That's a legitimate one. Okay. Let's go. I think we're going to go back to the phones here, and let's take Stephen in Clearwater. Stephen, good morning. Welcome to the program.
Is this the real Dr. Lange?
In the flesh.
How can you prove it?
I could be an AI bot. You never know.
Oh, there you go. Okay. Yesterday, and I'm not going to mention any names because it's going to sound like a political statement, but I'm going to say a politician yesterday gave a remarkable talk about chronic disease in this country. It was one of the best things. He's not a scientist, but he gave a report as to how much chronic disease is in this country. And in research, we tend to want to go after acute problems, the cancers, the heart disease. But the chronic illnesses, the autoimmune problems, the thing is mushrooming in this country far more than anywhere else, even in third world countries where you think they'd have more problems. And I think if anybody is interested in preventative disease, and that sort of probably is a large reflection of your audience, look this up, and you might even want to post it on your website. It's a remarkable non-political statement as to why we have to go after chronic disease with the same intensity as we have for acute. It was a remarkable speech yesterday, and a scary one too.
Amen. It was. And it just goes to point out that people need to listen to this show and shows like this, because you have to take the bull by the horns right now. Don't let the government tell you what to do. And you have to start practicing the things that we discuss, Dr. Summerton and I discuss on this program all the time. Proper diet, something like the Lange survival diet, proper supplements that aren't, adulterated and polluted, exercise, sleep, hydration, positive mindset, avoiding the foods. A lot of the foods that you're consuming are toxic. So the overly processed foods we got to avoid. And so, we can change. It's just very difficult. Think about it. Everybody wants to go to fast food and quick food. Everybody wants to pop something into the microwave or the toaster, or when it goes to the fast food restaurant. And, you are what you eat. So that's why, I've been doing this show for 30 years, and we try to keep people healthy, live a little bit longer, be a little happier.
Well, yeah, and there's sort of a conflict of interest, too. And this isn't evil. It's not a conspiracy. It's just the way people, the natural human think. When you go to think about it, acute diseases do not provide a continuous revenue stream to the medical community. Chronic disease does produce a chronic revenue stream. And in fact, it's sort of a never-ending gravy train. When you get a patient with a chronic disease, I don't mean there's no ill will in this. It's just a natural human tendency to want to gravitate to these specialties for these medical students, because they know it'll be more They won't have to work to get patients,
Right.
I mean,
yeah,
and
you are correct. I mean, we all get paid for people being sick. I mean, think about it. Doctors, hospitals, big pharma, and all that. But that's going to be around for a long time. And thank God we do have these things. But we could put a dent on some of their income if we were healthier. That's so true.
well, why don't we make why instead of having it the fee structures in medicine based on, office visits and stuff like that? Why don't we have a fee schedule based on outcome? In other words, if this patient loses this, for instance, here's another thing that bothers me. All these weight loss drugs that we talked about last week and everything?
Right.
Okay. The overwhelming majority of the people who are taking these weight loss drugs could do it just through discipline. There's some people can't do it through dieting. I understand that. But the overwhelming majority. And if I'm a taxpayer and this person over here is taking taxes on Medicare and stuff for prescription drug plans, they're cheating me. They're stealing from me because they're taking a drug they don't have to because they're too lazy to do it naturally. Do you understand what I'm saying?
Absolutely. It takes a lot of discipline, a lot of willpower, and a lot of sacrifice to do the things that you should to be healthy today. And
yes,
Steve,
and
we're getting loaded up on a lot of phone calls, my friend. You bring up a valid point.
One more thing. You not only have to have discipline by the patient to do what they're saying, but you got to have the discipline in the physician to say, no, you don't need this.
Yep, you're probably right.
All right. I've said enough.
All right, Steve.
Okay.
Take
Bye.
care. Dr. Summerton, before we take the next call, he does bring up some valid points, right? I mean, that's why we enjoy talking to our patients, not just about eyes, but we talk to them about how to become healthier, don't we?
Right. And we do treat symptoms. Traditional medicine does treat symptoms, and there is a time and a place for that. But while we're treating the symptoms, making the patient feel better, we need to kind of get to the root cause and how we can look at the long-term picture and figure out, well, how can we help this long-term? And, there is a time and a place, but it's us helping the patient, advising the patient, being available for them, and trying to help motivate them. And sometimes it takes more than one person. It takes a whole group working together.
Yep, a team approach. And we're going to talk about some anti-nutrients to eliminate from your diet in just a few minutes called oxalates, but we're going to take some phone calls. Let's go to Sandra in Tampa. Sandra, good morning.
Good morning.
What can we do? Yes, ma'am. What can we do for you?
Who am I speaking to?
Dr. Lange.
Okay, that's a good thing. My question is, I'd like to know if you or Dr. Summerton has a couple of names that you recommend for HRT therapy, and also any comments you might want to make on HRT therapy.
So hormone replacement therapy. We could probably make some recommendations if you want to email us after the show. Let me give you my email address. You got a pen and a paper?
I can't do that. I can't do that.
Are you in the car? Okay.
No. It's just, no, I can't. I don't email. Side effect of cancer arm situation. So I don't use my arm for that.
What about cell phone? Can you call cell phone?
Yes, I can call cell phone.
I'll give you a cell phone number you can call.
Go
Everybody's
ahead.
going to be calling me now. It's 352-208-3108. So 352-208-3108. And you can call maybe about 11:30ish or anytime during the day. If for some reason I don't answer, just leave a message and then I'll get back with you and I'll discuss, who's good in the area. But here's the problem with HRT therapy. If you don't find somebody that knows what they're doing, excuse my French, they can screw you up. Okay. So
I absolutely do realize that. And that's why that's my number one mission, is to find a quality person.
Right. And, we've got testosterone, we've got estrogen, we've got progesterone, and, these things have to be in a ratio. And I see many men that go in for HRT therapy and they're worse than when they started because now their estrogen is so high, and then they have to get on Amiradex and other drugs to bring their estrogen down. And some of these people, they think, oh, my testosterone's 2,000 right now. and they think, oh, this is great, because I'm so vigorous, but they're literally harming themselves with such high levels. So,
Right.
yeah, you have to find somebody that really is in tune with this, and we know a few good people. Dr. Summerton, you're in tune with a few doctors in this area too, aren't you?
Right. And there is a lot of good doctors, and there's more and more research coming up about which hormones we should take. What I do kind of always go, just like we do with nutrition, we always kind of want to lean towards the more natural. I'm more of a proponent for the bioidentical hormones, that kind of more of a plant-based, but you do have to be tested, and that's it, because our hormones change. So you need a baseline hormone testing, and then the doctor can determine, what hormones. You being a female, it's probably going to be the estradiol and the testosterone a little bit. Bioidentical hormones are like little pellets they can insert under your skin, but everyone's different on the dosage and how they process it. So you need baseline testing, and then you need follow-up testing and adjust accordingly to it. Not only the test, but how you're actually feeling after it as well, to take into account the whole picture of your whole health. And we had scares before about oral estrogen and synthetic estrogen. So we've learned a lot over the years about dosing that. And now it's more towards kind of this subcutaneous pellet and creams that tend to work a little better. So it's finding out which is going to work best for you and having that doctor fully evaluate you for it.
Right. I do realize that. But I just don't want somebody to go at it on me like I don't want to go at it willy-nilly. I do want an experienced person that can deal with lots of factors to be considered with the dosing, like you're describing.
Right.
Does that make sense?
Absolutely.
Yeah, it may take a few months, even 6 months, to kind of find where you're supposed to be at. And it's just, taking the time and working with it, giving your feedback on how you're doing. And there is a lot of good results out there, because we've learned so much over the most recent years. We kind of, especially for women's health, we've kind of ignored that. There was that big study where we're all scared of estrogen for a while, but now we've learned more, and we know we need it. And it's anytime after that menopause age, or even perimenopause, to help balance and for help our bone strength, and just help our overall energy, and help us live longer, healthier.
Right. Those are all the reasons I'm on the look, because I'm familiar with the Women's Health Initiative approximately 20 years ago, or whatever it is, and how, the outlook on this. In other words, let me give the short version. If you would have asked me 5 years ago if I'd be inquiring about HRT, I would have said absolutely not. Because I did have breast cancer, so I have a history of breast cancer. And I also took hormone replacement therapy in my 40s. Then I got breast cancer. So saying those two things years ago would have meant like, no hormone therapy for you. And I wouldn't have wanted it either. But now it's because of the new studies recently, and the turnaround on that opinion, and the discovery of possibly errors in that big study with who they so okay, you know what I'm talking about there then. So now that I'm aware of that stuff, and I'm 73, and I'm very muscle conscious, and still want to be as healthy as I can be and do whatever I can do, now I want to consider the hormone replacement therapy. But it really, because of what you've heard me say, it has to be somebody that really knows what they're doing.
And Sandra, so what I'm going to do after the show, I'll get with Dr. Summerton, and we'll combine our minds, and then you'll call me later on, and I'll have a few different choices of people that we think may be good for you. Okay.
And Dr. Lange, I've been listening to you a lot, and it's all about eyes. So I almost a little bit apologize bringing up a curveball question, but my eyes are definitely a part of this.
Right.
And I've been listening to you very intensely. and Dr. Summerton, and I really appreciate all the knowledge you're throwing out there to us.
Well, thank you, Sandra. And we like curveballs and fastballs, so not a
Okay.
problem, okay?
All righty. Call you later.
Thank you. Bye-bye.
Thanks.
All right, we're getting ready to take the next caller. If you got a question, 1-877-969-8600. That's 1-877-969-8600. We are going to talk about oxalates, and we're going to talk about the way I'm healing my knee in just a minute. Let's go to Gene. He's been waiting patiently. Gene and Keystone Heights, good morning. Welcome to the program.
Good morning. The reason for my call is that I've been diagnosed with dry eyes for quite a while, and it just seems like I keep getting prescribed all kinds of eye drops and things for dry eyes, and it seems like a constant procedure. And I also have a cataract, and I don't know if that has anything to do with it or not, but I'm waiting on the VA, which is taking their really good time about getting me some help to get that cataract removed. So
Right.
that's about it.
Let me tell you, Gene, first of all, if you have dry eye, you definitely want to get that dry eye under control before cataract surgery. I mean, that's one thing that Dr. Summerton and I do is, we try to get this keratitis or this dry spots on your cornea gone before cataract surgery, because that gives you a much, much better outcome post cataract surgery. So if your eyes are dry going into cataract surgery or dry going into LASIK surgery, they're even drier after. So we want to get it under control. The good thing about dry eye, a lot of this we can treat fairly naturally and holistically. So I'm going to go over just a quick 4-prong or 5-prong approach. We heat the lids, all right? At nighttime, maybe twice a day, you heat the lids with a warm washcloth or one of those masks you put in the microwave. This opens the meibomian glands and allows you to secrete a healthier outer lipid layer of your tear film. This is really crucial. Then we clean the lids after you heat them, because after you heat them, all this debris comes out of these glands. You want to clean it off so it doesn't just go back in and clog them. So you heat them and you clean them and you lubricate them. You want to get a lubricating eye drop that is preservative free. The two that I really like best, and I think Dr. Summerton likes too, are Optase and Oasis. We've used those for years. They have hyaluronic acid in them, which is a natural sort of anti-inflammatory. They tend to work. There's some other good ones you can buy over the counter, but these tend to last a little bit longer. So write that down, Oasis or Optase. And then we nutrify the glands, basically. We want to have a anti-inflammatory type of diet, like the Mediterranean diet, the paleo diet, or my diet, the Lange survival diet. And we add a few nutrients, some certain nutrients that are really good for dry eye because they act on inflammation, are omega-3, the reesterified triglyceride form of omega-3, like Fortifeye Super Omega, or there's a few other good ones on the market. Curcumin is very good. Of course, we have Curcugen, the Fortified Next Gen Curcumin. And then gamma-linoleic acid that comes from borage oil, black currant seed oil, or evening primrose oil. And I'm holding up a little kit right now. It's called Fortifeye Advanced Dry Eye Therapy, and it tends to have everything that you need from a clinically studied nutritional standpoint. It's called Advanced Dry Eye Therapy. So now we heat them, we clean them, we lubricate, we nutrify, and then the last is hydration. Most of us do not drink enough of the correct fluids. Coffee, tea, and alcohol are not the right fluids. They are diuretics, basically. So drinking more water and getting some electrolytes in there too. So eating a banana and a handful of nuts and seeds every now and then. The combination of all these things can help. Now, there are some prescription medications that your doctor can prescribe, all right, for dry eye, and sometimes they work quite well and sometimes they don't. We do punctal occlusion. You can talk to your local eye doctor about this, where they put a little plug in your drainage duct, okay? That actually keeps your tears on the eye longer. So your eyes are bathed in natural tears, or when you put an artificial tear and it stays on longer, it's covered by your insurance. The VA can do it. It should be no charge to you. And then there's some other things we could do: amniotic membranes, special drops that have amniotic fluid in them. I want to make sure I'm not missing anything. So Dr. Summerton's an expert in dry eyes. I'm going to let her chime in so you get two brains for the price of one.
I think you've covered all the bases there, and we have to remember this dry eye is a form of inflammation. It's inflammation of the surface of your eye, and it's about making you feel better and making you see better. When we stabilize that tear film has to be the right thickness for you to see clearly. So if it's too thin, you're blurry. If it's too thick, you're blurry. And that's partly why Dr. Lange was mentioning you want to fix that before you go into cataract surgery, because otherwise you feel like you won't see and have the success of the cataract surgery seeing clearly, because your eyes will be aggravated a little bit more by the surgery and still dry. So we making you feel better, giving you the lubricant and stabilizing the tear film, but then working on the inside, figuring out how we lower the inflammation with the omega-3s, the turmeric, getting all the gunk out of those glands so those glands can put that good oil into your tear film. And it sounds complicated, but it's just kind of a approach where we have to work on it, or it's not going to be immediate. I mean, a lot of people, it takes about 6 months to get them feeling better.
Yeah. Well, I when you were talking about lubricant, they sent me, it's called Stye, and they wanted me to put that in there at night before I go to bed, because I wear a CPAP machine every night, but I don't know that it's blowing air on my eyes or what. I don't think it is, but maybe contributing to the dry eye problem. But they did send me, and the name on the box is actually, it just says Stye. I guess it's what you might take.
Yeah.
You had a Stye on your eye.
My favorite lubricant, we do see a lot of patients using the sleep apnea machines with dry eye. It's great you're using the apnea machine, because there is a connection with sleep apnea and glaucoma. So you want to make sure you are getting that oxygen, because that will lessen your chance of the glaucoma. But because our eyelids, it's the only part of our skin that doesn't have a layer of fat, and that's so that the air can get to our eyes while we're sleeping. So if there's just a little bit of extra air coming out of the mask, it will dry out your eyes. So I like the hyaluronate ointment. That's a really nice one that protects it while you're sleeping. It has a little bit of vitamin A in there as well. That's a good one to protect, because we still want you to use that sleep apnea machine that we know is aggravating a little bit, but we do our best to lubricate it to protect you while you're sleeping.
I see.
Yeah, I agree with the Hyaluronate. Hyaluronate is made by Optase, and we prescribe that to a lot of patients that have the sleep masks, and it does help. Also, turn your ceiling fan off if you got a ceiling fan on, and make sure your air-conditioned vent isn't blowing right on your body. All that can help as well. But, you should be able to talk to your doctors. How old are you, Gene?
I'm 77.
Yeah, so you're old enough for Medicare, so you can go to any doctor you want for a dry eye consult if you're not getting satisfaction where you are now, and your Medicare will cover it.
Okay. I'm kind of, I was on the phone yesterday trying to find I have a secondary insurance through United Healthcare, right, and Medicare, and they were trying to get me an appointment for to see an ophthalmologist, basically about the cataract, and maybe being able to talk to somebody else to get a second opinion. Sure.
And you'd be closer to Gainesville right there. So there's a lot of great ophthalmologists in the Gainesville area.
Yeah, I am. I'm only just right down the road.
All right. And then one last drop I'm going to mention that I really love and we all really love is called Regenerize. So Regenerize is a drop that has some of this amniotic fluid in it, basically the food that feeds the amniotic membranes. And we've got some great results and some interesting science with the Regenerize drops too. So keep that in the back of your mind.
Okay. I got that written down. So.
All right, Gene.
That's the first time I heard your show on the on my radio in the morning. So when I'm trying to get ready to get going, but it's better better than some of those other morning shows I hear. But
well, thank you. Yeah, I've been in that area on 97.3 FM, The Sky for 31 years now.
Really?
Yeah.
Okay. Well, I listen to the AOK or whatever it's called. I don't know what in 97.3 for quite a while because but you know a lot of times I'm not really interested in the stock market and calcium replacement or whatever they're trying to sell.
Sure.
But yours is really interesting. So, especially when I do have a problem with my eyes, and I surely would like to, and light now seems to be a problem, because I have to try and find the darkest glasses I can put on when I go outside because it seems to mess with my eyes.
Right. That's Gene. That's your cataract. All right. So the cataract is causing you to be extra light sensitive. Cars' headlights will have starburst effect around them. When you walk out in the sun, you're gonna have to double up on the sunglasses. Put a hat on. Okay. And once you have the cataract removed, things will be better. So it sounds to me like cataract surgery is in the cards in the future. Okay.
I'm trying. I had one done about 3 years ago, and it's probably doing all the work the other one can't do. So,
well, thank you for the call, my friend, and keep tuning in. Any other questions, you call us anytime. Okay.
Okay. Thank you very much.
Bye bye. All right, you're listening to Ask the Doctors, Dr. Michael Lange and Dr. Susan Summerton, both of the Lange Eye Institute in the Villages, Florida. That's just a hop, skip, and a jump wherever you are. I'm going to give you the phone number for the Lange Eye Institute. I'll give it to you twice. Then I'm going to give you the phone number for Fortifeye Vitamins. So get your pen and piece of paper. Lange Eye Institute is 352-753-4014. That's 352-753-4014. And Fortifeye Vitamins, and they're taking calls right now, is 866-503-9746. That's 866-503-9746. And you can go to fortifeye.com. That's FORTIFEYE, fortifeye.com. Before we dive into talking about oxalates, I want to talk briefly about something that literally I developed, all right? And Dr. Summerton helped work on the development of this as well. It's called Fortifeye Rejuvenate. And the reason I'm going to talk about it, a lot of you that know me have seen me limping a lot lately. Well, back in the day when I raced competitive motocross, I broke my right leg in 5 places, my back and my neck. And so I'm a little predisposed to injuries maybe. And I was mountain biking. Maybe close to a year ago now, fell off a cliff and hurt my knee really bad. And you've been seeing me limping in the clinic and limping around. Well, you're not seeing me limp as much anymore. And for the last 7, 8, 9 months, I've been limping. And then I started taking this about 4 months ago. It's called Fortifeye Rejuvenate. And what it is, it's a combination of multitude of nutrients that have been shown to help with joint health, but also help skin, hair, and nails. So women and men love it. So Dermaval is in this. Now, Dermaval has been clinically proven it's a natural complex that actually inhibits enzymes that degrade the elastin and the collagen in our bodies. So this is a combination of acai, mangosteen, pomegranate, camu, arceola cherry, quercetin, asparagus, okra, coffee berry, and something called Japonian flower. So these have been shown to help our body rebuild collagen and elastin. Then we're one of the first in the country, if not the world, to use a marine collagen tripeptide. A tripeptide absorbs more rapidly than a peptide. The marine collagen tripeptide, the studies are amazing. With only 1 gram showing minimization of fine lines and wrinkles in the face, and reduction in pain in the body. So, marine collagen tripeptide, rice ceramides directly from a study that proved that this particular type of rice ceramide from Japan was beneficial at decreasing roughness in the skin and creepy skin. All right. All of us know about the crepey skin, right? German hyaluronic acid we put in it. Great for the joints, great for the skin. And then we added liposomal vitamin C made right here in America, biotin for the hair, a little vitamin E, D, B complex, and a few other little minerals to help make it work a little bit better. So it's called Fortifeye Rejuvenate. If you look at it on the website, it's some amazing testimonials, hundreds of testimonials and reviews already, and we've only had it out about 6 months. I take it. I think, Dr. Summerton, you've noticed some benefits from it as well, haven't you?
Absolutely. I have noticed right within about 2 to 3 months, just a lot more hair growth. I see all these hairs around my scalp all kind of sticking out. I know it's all new hair growth. It's all about the same length. And you look down at your nails and see how they're growing faster and they're not breaking. And so it's kind of nice. A lot of supplements you take, you don't get as much feedback because you can't see directly by looking in the mirror or looking at your skin to see the difference. But this is one that you can okay, I know that I'm absorbing it because I can actually see it working. And we just don't get a lot of collagen in our diet. Collagen comes from the skin. So I know personally, I love seafood, I love fish, but I'm not eating the skin of it. So I'm missing out on that marine collagen when I'm intaking my fish protein, but I'm not getting the collagen part of it. So that's again, I'm not getting it from my diet. So that's something I want to supplement. And same, even, skins, you're not eating the skins from a cow. You're not eating chicken skins, maybe, but usually that's if it's fried chicken. So we don't necessarily want that. So it's one of those things that we've got to supplement.
And, Dr. Summerton, while we're talking about some nutrients that we aren't getting enough of, the lion's share of the people that are listening to our show right now are not getting enough protein. But let's address female athletes, all right? A lot of female athletes have this misconception. They don't have to eat much protein, okay? And a lot of my friends that are female athletes, I say, what'd you have for breakfast? Oh, I had the hard, healthy oatmeal. I mean, it's so good for me. It had 2 grams of protein. Now, isn't that a fact that a lot of female athletes aren't getting enough protein? And will this help us, especially post-exercise nutrition? I mean, what can we do, not only as a male athlete, but especially a female athlete?
Right. There's a big trend has been on fasting, and the intermittent fasting where people go for 20 hours without eating and they just eat for 4, which can work temporarily, but now our long-term kind of studies, and the problem with a lot of the studies is who they are studying. And unfortunately, a lot of these studies are done on obese men. And even those studies are turning out that we kind of need to eat with our circadian rhythm. So if you are fasting, it's better to eat between 8 and 4 p.m. and have the evening hours without it. Well, that being said, a lot of women, I myself was guilty of this. And when you're younger, you can get away with it, but just getting up and going to the gym fasted. But we now know for active women, that's actually pretty detrimental. And it's just the way our oxidative fibers are. That's kind of how we handle that aerobic exercise. So what is the recommendation now is we need about 15 milligrams, not a lot, but about 15 milligrams of protein before we head to the gym and do those resistance trainings. Because if not, we go through that glucose first, and then there's those free fatty acids in our women. We can't access kind of that liver muscle glycogen like men can. So we need that little bit of protein in our system so it doesn't release cortisol, which cortisol is stress. So we don't want to create that stress. We want to give our body that fuel so that we can hit those high intensities, so that we get those benefits post exercise of like growth hormone response, and even releasing a little testosterone, just a little bit for women. And then what's also important for women is, because of the way our bodies respond and not tapping into that liver muscle glycogen like men can, we really need to, within 45 minutes of finishing our exercise, that's when we need even more protein. Not quite as much for younger women, but again, as we age, the kind of perimenopause, menopause age, we need about 30, even up to 60 grams of protein after we exercise. And I know myself, it's hard to get that. And so that's where it helps to have like these protein powders that you can mix with water. So you're getting the hydration, because that's another thing. We tend to be dehydrated. So we need about 15 grams of protein before we work out, and it's 30 and up after. So it's a good time to also have your meal after you work out at the gym. And it's just kind of being aware to maximize, because we know it's a lot of effort. And so we want to maximize what we're doing with the right nutrition.
Absolutely. Very well said. Amazing the things you can learn from this program. So check out under performance nutrition, go to the Fortifeye website, and we have a section now, GLP-1 receptor support section for everybody on those drugs. And performance nutrition, you can look at the different proteins. So we have whey protein isolates, we have whey protein concentrates, we have the new vegan super protein that's a complete protein with a PDCAAS score of 1. So all of you vegans, or if you just want to mix it up and have something that's salted caramel mocha flavor versus just the vanilla and chocolate, the vegan super protein has it. Remember, we didn't push vegan proteins much at all, because most vegan proteins weren't complete proteins that didn't have much protein, and they were chalky and grainy tasting, and were very high in all sorts of anti-nutrients like phytic acid and lectins and oxalates. So we've got sprouted ancient grain barley and sprouted pea protein, non-GMO pea protein, and we added velocitol to it to actually help with reduction in muscle protein breakdown after you work out. Remember, the post-recovery shake is very important right after working out, because it also replenishes muscle glycogen, which is important as well. All right. Phone lines are open, 1-877-969-8600. That's 1-877-969-8600. Remember, you can go to fortifeye.com, Fortifeye, fortifeye.com. I will be at the Fortifeye Nutrition Center today at 1 o'clock. I'm going to bring my brother Rick too. So he works out a lot. Maybe you guys and gals can talk to him a little bit about training. So at 1 o'clock today, 1 to 3, my brother Rick and me will be over at the Fortifeye Nutrition Center in Clearwater on McMullen Booth Road, right there in the Bayside Bridge Plaza. All right, we're going to talk briefly about oxalates, because a lot of you out there have had kidney stones, all right? And I'm one of them. So I became an expert in oxalates. Oxalates are an anti-nutrient that are in many foods, many vegetables out there, and fruits, specifically spinach, soy, almonds, and beets. Spinach is the highest. So what can you do to reduce the oxalates that can cause kidney stones? You boil the spinach, or you just don't eat it, all right? You eat baby leaf kale or bok choy, virtually no oxalates. You take a good probiotic like the Fortifeye probiotic bacteria. You pair the spinach or any of the things, the beets, with something that has calcium in it, like goat's cheese. That helps reduce the chance of you getting kidney stones. You drink more H2O, more water. Add a little lemon to the water. So this will actually dilute the amount of oxalates, and it's very good for your kidneys. So most of us aren't drinking enough water. So remember, boil your vegetables, take a good probiotic, or eat some fermented foods. If you're going to eat spinach, maybe cream spinach, okay? All of these things can help. You do not want a kidney stone. They are very, very painful. All right, we got time to go to, I think we got enough time for a quick call. Let's go to Cal in Seminole, Florida. Cal, good morning. Welcome to the program.
Good morning. I've been taking your Super Omega 3 Max and Focus for 1 year. My dry eye is completely cured. I also did the mask and so on and so forth. And I've cut back on the focus to twice a week.
Right.
And I wanted to know if that's okay.
Oh, absolutely. I mean, twice a week is better than nothing. Those are 3 carotenoids that are very good for you. You really can't OD on it. And the omega-3, I would keep taking that. That's one of the best forms of prevention from a supplement standpoint. I always tell people, if they only took 1 vitamin, it should be a good reesterified triglyceride form omega-3. So, Cal, keep it up.
All right. And also, Arlene's been terrific. I just have to pass that on. I've also got a knee problem, and I'm going to try your Rejuvenate.
Awesome. Try the Rejuvenate and keep us posted, Cal. We got to go. We're out of time. Dr. Summerton, you got 10 seconds.
Wishing everybody a blessed day. Go outside, enjoy some sunshine, do your best form of movement that you enjoy, and have a wonderful day.
We're out of here. God bless you. See ya.